Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, Dr. Andy Roark. Guys, I got a great one today. I am here with my friend, Beckie Mossor, RVT. She does a million things, but she is here mostly because of her role as president of NAVTA and also her role as writer of really great article in the magazine Today's Veterinary Nurse. And so I want to talk to her about her latest piece, and it comes from work that she's done with NAVTA. And that's how we get into this. So guys, this is a super good episode about understanding where our vet techs are at and where they're coming from and where they're going to and how they're feeling about our profession and the future they're in. And so I really like it. I think I asked Beckie some kind of hard questions, and I think she's got some really good, insightful answers. So anyway, you guys can decide for yourself. Let's get into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast. Beckie Mossor, how are you, my friend?
I'm outstanding. Thank you so much for having me here.
It is my pleasure. I love to get to talk to you. I have known you for years. You always bring a huge smile to my face when I meet you. You do so many things. You're kind of like me in that I think you get bored very easily and you can't live your life without a lot of hobbies. Is that true?
It's super true. It's super true. And because there's so much cool stuff, right? There's so much opportunity in our profession. There's so much good stuff going on that is like, I'm not hopping from planet to planet, but there's so many places to go within our space.
Yeah. So for example, for those who do not know you, you are the co-host of the Veterinary Viewfinder podcast, which is a very successful podcast in the vet space. You guys have been going for like 9 years now.
9 years.
You have a huge library. You have a ton of topics. You do it with Dr. Ernie Ward, who is just a great guy and again, a well-known figure and thought leader in the vet profession. You are the president of NAVTA, which is the National Association of Veterinary Technicians in America.
Yeah.
You are the practice management coordinator at Appalachian State University, which is here in North Carolina. It's for their veterinary technician program.
Yeah.
Tell me a little bit about that.
Oh my gosh, it's such a fun program. One of the few online veterinary technician bachelor programs. We're really proud of that. We've got a great team. It's completely online, and Appalachian is it's just a great community school. It's one that really, loves its students, serves its students. I'm really proud to be a part of that team.
You should be. I think it's a very cool role. I love how you continue to work in vet medicine in all these different ways, and you're supporting the techs and just in their professional roles and then also in educational roles. And I love it. And I wanted to talk to you because I saw a really interesting article that you wrote in Today's Veterinary Nurse magazine recently. And basically you were going through and unpacking the results of NAVTA's 2024 demographics survey.
Yeah.
And so why don't you go through just a high level and kind of lay out what this survey is. And then I want to get into some results here, and I've got some questions for you.
So the demographic survey is something that NAVTA does every 2 years in order to get really their finger on the pulse of the industry and to have some, longitudinal data to look at our industry overall. So it's really nice to have this comparative data and to see kind of what changes from 2-year increments across the industry. So overall, we look at veterinary technicians, veterinary assistants, kind of all across the program, all across the industry, and we look at all of the different demographic aspects of their jobs, and then kind of try to drill down into what the major concerns, the major struggles of the industry are, and to get an idea of the thoughts of our veterinary professionals and kind of how long they think they'll be in the industry, what their job satisfaction is.
You pulled out a couple of sort of key features that people were obviously really interested in and meant a lot to them. The top one that you sort of started discussing in this article is around title protection and credentialing. Can you go ahead and just lay down for people, maybe there's people who aren't really in the tech world or don't really pay attention to that space. Talk to me about the interest around credentialing and sort of title protection, just to lay it out from the top. And then what did you see in the survey?
So the survey, I think the number one thing that stood out as like the most unanimous aspect of the entire survey is we want to see title protection. 90, I think it was 3%.
It's like 94%.
Yeah, 94%.
You've got so many things that are in the 90% here. It's really kind of mind-bending.
Our whole profession wants to see a standardized credential. Now, there is a lot of diversity between what that credential should be, right? And so there's a difference of opinion between should it be RVT, LVT, CVT, how it's addressed. But the overall decision is we need a standardized credential. And I think that's a big message to NAVTA. Now, it's obviously one of NAVTA's number one strategic, projects is working toward this title protection and how do we really make big moves in that area. But it's what every technician wants, basically.
Yeah. So looking at your numbers, I think you were right. I think it's 93% of respondents strongly support protecting the title of veterinary technician. And so I was looking at having a nationally standardized credential. It's 17% agree, and then 73% strongly agree. So you're at 90% agree that they want this sort of national credential. And so, but Becky, people have been talking about this for decades now about the ability to move between states and the credentialing being limited to one state or another. What if 90% of technicians are like, yeah, we should have some sort of national standard? What has held us back? Why has it been hard to move in this direction?
Well, it takes money, first of all, right? As you can see kind of in the numbers, for one thing, it's what do we change it to?
Yeah, okay.
So, what is the national credential? Okay, everybody wants one, but if you look, there's this division between is it licensed technician, registered technician, LVMT like they have in Tennessee, and then the whole nurse aspect of it. Now, over half of the technicians want to move toward the title nurse, and it's in the 60% that lean toward the title nurse. It's not a huge majority, but it is a majority. But we also saw kind of what happened legislatively when we tried to move toward that. So there's a lot of obstacles and there's no clear path forward, even though we are all on the same road about getting a standardized credential. We're all filtering out in different directions when it comes to what that is.
Everyone's like, yeah, let's totally align with my title that I have. Everyone should get on board with what I already have. Yeah. And that should be it. It's fascinating to me, but it's true. When I would go and speak, especially in Canada, I got in the habit of asking people, what are the technicians in this area usually credentialed with? Because there are places where I would say, you're LVTs, and they're like, excuse us, we are RVTs.
Yes.
And I mean, seriously. And it's the first time it happened, I was like, oh my gosh, I'm sorry. And then I got to the point where I was like, try to ask, because I know that it's clustered by state, and it's just one of those. It's almost like when people ask politicians if they know what a gallon of milk costs here, just to see if they actually have paid attention to the area that they're in.
Yeah.
And so, it's amazing to me that matters. Yeah. Or at least enough. You have to know it's important. You know what I mean? And you have to sort of recognize it and care. I think that's important, because it was just interesting, a thing that I learned, that, boy, these people have gone through it. They've done this program. They've got this training. This is a commitment, and they've gone through it, and they want to be recognized for the work that they did and the degree that they have. And it absolutely makes sense when you think about it. But it was one of those things, I think, if you're not in that world, you wouldn't know, or you don't understand what it means to people.
Yeah. Well, and then it's interesting, right? Because then you see these other technicians who have RVT, LVT, CVT, because they're licensed in states that all have the different credentials. So they carry the different credential behind their name, which I think leads to kind of further confusion in a way that there is some differentiation between them, and they are, universally about the same. So within our own profession, there's a lot of the Rubik's Cube is not all on the same color squares, and we've kind of got to get that straightened out, because that, I think, is a lot of what's holding us back to a unified credential right now.
I mean, that's interesting to hear, that that's sort of the stumbling block. Let me ask you about income and overall job satisfaction. So this was another sort of finding. We're looking at sort of what's important to vet techs in the survey. And one of the things I was really happy to see is that we continue to see salaries for veterinary technicians go up. And I think it's a fairly significant jump from 2022 to 2024. So the average hourly rate was $26.50 in 2022, and it's up to $32.89 in 2024. And so that feels good. And the thing that I'm struggling to get my head around, Becky, is at the same time, job satisfaction for technicians has gone down from 2022 to 2024. The number of technicians that were very satisfied with their job. Dropped radically. It was from like in the 30% very satisfied, to like 8% said they're very satisfied. And that seems like a monumental drop. It's a 75% reduction in the number of people who said we are very satisfied. And at the same time, salaries have gone up. It feels to me like more people are getting lunch breaks and regular breaks that they should get than they ever have before. It feels like the profession is more focused on wellness than they ever have been in the past. Help me understand, how do you sort of square these things in your mind, Beckie?
A couple things. So first of all, I feel like that I hate to say this in a pessimistic way, because you know me. You know I'm like super optimistic, to a fault. The job salary change feels like lipstick on a pig to me. Because number one, if you're not making enough money to live and you give me X number of dollars more an hour, I still probably can't live. So when we look at like the cost of living, we look at what the poverty wage is, and we look at what vet techs are now making, it's like, well, they're making closer to not being in complete desolation. Yeah. That's nice. But they're still not making a living wage in most areas, right? So again, that feels a little, and if you look at the just cost of inflation, cost of living over 4 years, we're really only looking at like a 3% increase a year for these wages, when we're looking at inflation probably being a lot more than that. So when it all comes out in the wash, they're basically making the same as they were before, because it costs a lot more to live over these last 2 years. In addition to that, I think that there are some folks that are doing it really good, right? Like really good. So they're bringing those wages up and kind of moving that curve a little bit. But I think the majority of wages are still really desolately low for our industry.
Do you think that there's a smaller number of practices that are pushing those wages? There's two ways to look at averages, right? Let's say we've got 10 people and we give one of them $1 million. Well, the average wage just went way up across the board. It soared. The truth is only one person had any benefit. The rest are like, our wages are not appreciably different than what they were. Or do you feel like there is kind of an across the board rising of the tide? So tell me.
No, to that exact point. I really do think that we've got some outliers pushing the averages higher, that there's, some big cities, there's some big clinics. And then there's also expanding roles for veterinary technicians, right? So now you've got veterinary technicians in roles in academia who might be making up to 6 figures, close to 6 figures, making really good money, that are going to kind of throw those numbers off. I think your average general practitioner to veterinary technician is not making anywhere near $32 an hour.
That all tracks and makes sense. Yeah. I also think you've got a good point too, is let's say that you need $40 an hour to feed your family and you're making 22 and you get a raise to 26.
Yeah.
Yeah, I think that's a solid point. I think that helps me sort of get my head around it. What do you think is really drawing the drop in people saying that they're extremely satisfied with their job? I mean, you mentioned a couple of different factors in the article, but if you had to kind of point and say, this is why I think people who are extremely happy reduced significantly in number between 2022 and 2024?
I'd like to say that I know. What it feels like to me from what I hear is kind of one, more self-awareness, in the sense of just like kind of what we were just talking about. Like I got $3 an hour more over the last year or two, and I still can't make ends meet. When we look at the number of veterinary technicians who have a second and then even third job, I think that's driving that dissatisfaction. So I would say probably with the numbers of technicians who have had to get other jobs kind of being up, and even with the costs or wages being up, satisfaction going down, is it correlation or is it causation? Like if you just cannot live and you're having in this economy to work harder and harder to live, I think it just really drives the job down. We're also seeing more shortages in technicians. So I think it's really hard to be satisfied in a job when you're just being run into the ground with hours and responsibilities.
I think that all makes sense. I was disappointed to see that. I hate to see. Yeah, that it's a pretty significant downward shift, and I thought that was disappointing.
Yeah, it was bad.
Yeah, it was bad. one of the last things that you sort of mentioned that I want to bring up is around utilization of technicians. And so my question for you here, is we looked, and this was absolutely something that was sort of brought up, and everybody wants to sort of practice at the top of their license and feel like they're being well utilized. And you said, only 36% of veterinary nurses or technicians report feeling utilized to their fullest potential, while 44% feel they are sometimes utilized, and 19% feel like they are not utilized their fullest potential at all. This seems to be sort of a driver of discontentment for sure in the surveys among the technicians. And I'm looking at this, and so there's sort of two things here. There's one question that sort of asks technicians about, are you being utilized to your fullest potential? And then there's another question that asks about the overlap in job roles between credentialed technicians and non-credentialed assistants, you know what I mean? And basically asking, do you do the same job as someone who is not credentialed, or do you have other responsibilities that your credentials allow for you? Beckie, are those two questions deeply interconnected in your mind? Meaning, when I think, am I fully utilized to the highest of my ability? Am I looking at the things that I would want to do and I'm not able to do? Or am I looking at people who don't have my degree and saying they do largely the same job as me? Which of those two factors what do you think makes people sort of have that idea that I'm not being utilized to their fullest potential, I guess?
Yeah, so I would say it's a yes and, right? And I think the utilization is probably a lot more closer linked to job dissatisfaction than anything else, right? Because I think that when we're not being utilized to our fullest potential, in fact, I've heard veterinary technicians say things like a glorified holder, right? Like, I'm just here as a glorified restrainer, then our job satisfaction greatly plummets. And I think as we see veterinary technician specialists emerging and doing so much and knowing that technicians have this high level of skill and we're educating, we have more access than ever to education because it's all online now. We're learning all these cool things, workshops at all these things we want to come back and do. There's nothing worse than going to a conference, going to this really cool workshop, coming back and no one cares. No one cares. No one cares you learn that. No one wants you to be able to do that thing. And you go right back to this life of answering phones, returning phone calls, and taking temperatures, right? So I think those are very closely related. I do think this about the whole assistant vet tech thing. If you are being underutilized and a non-credentialed individual is being utilized as much as you're really going to resent that. And that's going to really... So not only are they allowed to do everything that you're allowed to do, you're not allowed to do half the things you could be doing, right?
Yeah.
I think that there's very little likelihood that any veterinarian out there would utilize a veterinary assistant to the extent of a truly trained, credentialed veterinary technician to the skill that they have. Very few veterinarians outside of she's been here for 20 years. I've taught her everything she knows. Maybe those slip through. If a veterinarian really understood the whole scope of what credentialed technicians can do, they would never allow their assistants to do that. So they kind of lump them together and give them this ceiling that is equal. And that is where the frustration is. Does that make sense?
Yeah, it absolutely does. That's actually a really great way to lay it down. And I could totally see how those things would fit. Because the question for me was, if you came to me and said, Andy, are you being utilized as a veterinarian to your fullest potential? I would say, I have no idea. Am I busy every moment of every day doing the most advanced diagnostic procedure I could be doing? The answer is no.
Sure.
But, do I get to do stuff? Absolutely.
Yeah.
Do I, but it was just sort of, I think when I looked at that, I was like, how do you assess that scale for yourself? I think we all wonder, if my wife said, do you think you're being utilized to the fullest potential in our marriage? I'd be like, absolutely not. And I don't know what that means. And I don't know how I would quantify that, but my gut says I could do more in this marriage.
Tops.
I don't know what that is. Yes, exactly. 100%. I was like, buddy, turn me up to 11 and see what happens. But no, I think you really, I think you gave me the insight I was looking for, which is if I was a tech and I was looking around, how would I know how would I feel? And I think that you really pointed to that. And so I think I want to stay in this vein for 1 second because as someone who wants my techs to be happy and to feel rewarded and fulfilled, and I'm going to look at them and I'm going to think, did they feel like they're being used to the most of their potential? And so I think that you just laid down this sort of comparison way of looking at it that says, okay, this is a good way for me to think about it. If I had to press you on this, Beckie, and say, okay, seriously, what do you think are the most common things that dictate if technicians feel like they are being utilized at the top of their potential? Are there certain things that, in the clinic? Because I know that every veterinarian is going to look around and go, I think I'm utilizing my technicians, but I don't know it. And like I said, I can't give you things that don't come in the door.
Sure.
You know what I mean?
Yeah.
Like, if you work with me, you're never going to get to practice your CT scanner skills because we
Sure.
don't have one. But yeah, are there things in your mind that you hear in conversations again and again when your licensed technicians say, I am not able to do this in my practice, and the other techs go, oh my gosh. Like, what are those things?
Okay. So I think the best way to answer that question is to flip the question, the kind of thing you had on your head. So if you're like, am I being utilized in the clinic to the best of my ability? I don't know. Are you doing all the doctor things? Or are you doing the things that your technician's looking and go, hey, Dr. Andy, do you want me to do that? Do you want me to do that? I could do that. Do you want me to put that catheter in? Do you want me to run that anesthesia? Do you want me to recover this patient? Do you want me to suture that laceration? Do you want me to place that catheter for this blocked cat? Do you want me to do that means I'm licensed, skilled, and educated and able to do this skill. So if you're hearing that question, you are not utilizing your technicians because you're doing their job. So that's kind of your number one, I think, sign that you might be underutilizing them is if they're standing there watching you do something that they probably quite possibly do it better.
Yeah.
All
right. Okay. That's it. Okay. That
Have you
makes
heard
sense to me. No, I mean, now that I'm thinking about it, I will tell you, in all honesty, I think my techs would all say that Dr. Roark is pretty good about leveraging us. I'm a good delegator. I think I very much like to spread work around.
Yeah.
So anyway, Beckie, you are fantastic. Thank you for being here and talking through this with me. I really appreciate it. Where can people find you online? Where can they keep up with all of your adventures?
If you're online, you're mostly going to see my dogs and probably some of what I eat. But you can follow me on, I think it's Beckie_RVT on Instagram, VetTechBeck on TikTok, which is mostly me motorcycle riding. So that's it. It's all you get. There's not a lot of veterinary Beckie out there outside of the veterinary viewfinder, which you're welcome to check out. Like you said, lots of years of content there. So I'm on the socials, but it's mostly my life because in this veterinary space, I think that's an important thing to focus on too.
Well, if someone's like, how do I learn more about NAVTA? Where would you send them?
Oh, yeah, you guys head over to NAVTA.net. There's a lot of great information, including this demographic survey. So if you're interested in reading more about what this data says, you can also find the 2022 demographic survey there for comparisons.
Outstanding. Beckie, thanks so much for being here.
Thanks for
Guys,
having
thanks
me.
for tuning in, everybody. Take care of yourselves, gang.
Bye.
And that's what I got. Guys, thanks for being here. I really appreciate you guys. Thanks to Beckie and NAVTA for making this possible. And if you want to share the article out with your vet tech or vet tech managing friends, please feel free to do so. I always love it when the word gets spread. So anyway, guys, take care. Be well. I'll talk to you later. Bye.